o'clock. Near enough. Thank you.
Okay, we're now live.
Thank you. Good morning, everybody. I'm afraid we have apologies from Councillor Tim Swift today. So we have no chair for this meeting. So it has been discussed and decided that first point of order will be to appoint the deputy chair, which obviously I need nominations for, if anybody would like to nominate anybody. And then following the decision on that, whoever that is can take over for the meeting to chair it. Is everybody happy with that? Councillor Hutchinson?
Yep. Can I nominate Dr. Cleasby then to be deputy chair?
You can. Do we have a seconder for that?
I'll second that.
Thank you, Councillor Evans. Any amendments or any more nominations? No more nominations. Is everybody happy that Councillor Cleese becomes deputy chair?
Yes.
That's absolutely fine then. Thank you. Councillor Cleesby is now Dr. Cleesby is now the deputy chair, and I will hand over to him. Thank you.
That's very kind, everybody. I'm not being promoted, I hope, to councillor status.
I get so used to saying councillor, I'm so sorry.
I'll stick with doctor for now, if that's okay. Very good. Okay, so yeah, welcome everybody again to October's Health and Wellbeing Board. I think people are just still joining, but we'll continue. So, are there any further substitutes or to be nominated for the meeting, Diane?
There are a few substitutes today, Chair. We have, I'm not sure if she's present yet, I've not seen her, but Lorna Peacock is going to sub for the Locala, which the new member for that is now Mary Wishart. So that membership has actually slightly changed. Councillor Hutchinson is substituting for Councillor Tim Swift. Diane Cameron is substituting for Darryl Thompson, and Eugenia is substituting for Deborah Harkins. We have apologies, I'm afraid, from Deborah Harkins, Mary Wishart, Councillor Tim Swift, Councillor Megan Swift, Councillor Fenton Glynn, Councillor Courtney, Darryl Thompson, Robin Tuddenham, and Neem Cullen. Apart from that, everybody else is here.
Wonderful. Okay, thank you very much. And I believe this might be the first meeting that Penny Woodhead has joined as a member and as the second member coming from the Clinical and Professional Forum. So the Clinical and Professional
Penny Woodhead,
Forum
thank you.
Nominated Penny. Penny,
Yeah.
do you want to introduce yourself? I'm sure everybody probably has met you before, but just formally.
Yeah, good morning, everybody. My name's Penny Woodhead. I'm the Director of Nursing and Quality for the Calderdale, Kirklees and Wakefield places as part of the Integrated Care Board. As Stephen says, I'm the second nominee from the Calderdale's Clinical and Professional Forum.
Welcome, Penny. Okay, so item 2 of the agenda. Members' interest. Remind members of the need to declare any disclosable pecuniary interests or other interests they might feel they have in relation to any of the items on the agenda. So, opportunity to declare any interests. We've taken item 6 already, so I was obviously going to declare an interest in that, but are there any others from anybody else? This is your opportunity. No, that's fine. Item 3 on the agenda, it's not recommended the public be excluded from the meeting for the consideration of the items of business on this agenda. Is everybody comfortable with that? Excellent. Okay, so on to the minutes of the meeting of the 1st of September. Are they a correct record? Any amendments required? Anybody happy to agree that those are a correct record? Very good, Councillor Evans. And to second that? Anybody happy to second that? Thank you, Councillor Wilkinson. Okay, so those have been agreed. Don't know what the process is, Diane, for signing those off physically, or is it digitally, or will you? Sorry, you're on mute, Diane.
Yes, Chair, sorry. Yeah, there is a new process in the background since we've done a lot of things by Zoom, but you'll be advised as the Chair
Thank you
when
very
it's
much.
necessary. Okay.
That's good. Wonderful. Thank you then. Right. So item 5 is question time. There's rules and regulations around this. Have we received any by yesterday, the 19th midday, we were meant to receive them digitally. So have we received any questions, Diane?
I have not been sent any questions, Chair, and I'm not aware of any that are in the background.
Okay. Are we happy to move on then? Mike, yes to item 6. No questions to take today.
Well, that's right, Chair.
Lovely. Thank you very much. Item 6 we've already covered, so we'll move on to item 7. Living and working well. So Debs Harkins has given her apologies. So who will speak to item 7?
That will be me, Chair.
Wonderful.
Thank
If
you.
you could kindly introduce yourself and then take us through the paperwork.
Yes, of
Thank you.
course. Good morning, everyone. I'm Eugenia Cronin. I'm a consultant in public health. I lead on suicide prevention for Calderdale Council. I am here on behalf of Debs Harkins to present this living and working well item. So I'm just going to see if I can remember how to share my screen on Zoom. Would someone, oh, hang on a minute, I'm on the wrong bit of it. So let me just go back. Could someone let me know if they can see that?
Yeah.
You can. Okay, great. I'm actually going to stand up. Right. Okay. So as I said, I'll be leading this presentation alongside some colleagues. So colleagues from public health. Kate Horn will be presenting a part of this. Marie Conway as well, and our colleague Janice Wooten from Calderdale Cares as well will be presenting one of the slides. So what are we going to cover? It's really a very quick overview of our living and working well goal, which I know you all know, that I want to present quite briefly, two central public health models which we use around this. Then an overview of action being taken. And then we want to drill down into 3 areas of work. Those are integrating health and wellbeing support for adults, suicide prevention, and inclusion of people at most risk of poor emotional health and wellbeing and suicide. And then this should take about 20 minutes, I think. And then we have some questions that we'd like to pose to the Health and Wellbeing Board, obviously, as well as taking some questions from you. So as a reminder, the living and working well goal is that working age people have good emotional health and well-being and fewer suicides. Now, how are we going to know that this has been achieved? Well, our measures are improvement in the percentage of working age people with good mental well-being, excuse me, and that was at 57% in October 21. And a reduction in overall suicide rate, and that was at 15.6 per 100,000 people in the years 2018 to 20. So the first of the 2 models that are quite important underpinning this whole area of work is the 2 continuum model by Corey Keyes. And just to take you very briefly through that, it's tempting to think that mental health and mental illness are 2 ends of a single continuum. But this model suggests that that actually isn't the case. It suggests that you can have flourishing, what he calls flourishing mental health, whether or not you have a diagnosed or diagnosable mental illness. Conversely, it suggests that a person may have poor mental health and may be languishing, in Corey Keyes' terminology, without a diagnosed or diagnosable mental illness. Now, there are several implications of this, and I'm sure you're considering those at the moment. For me, the key kind of principle that this underlines is that we all have mental health, and we can all aim to have flourishing mental health. So the second of the models that actually frames the rest of the presentation today is what we call a prevention pyramid, and I'm sure you will have seen this before. So this underlines how we support prevention across the different segments, what we might call segments of the population in public health speak. So the largest population group is at the bottom, and our aim with this population is to encourage people, support them to stay healthy. And the core determinants, for example, here are around staying active, staying connected. And this is where we also, we do some of the clinical things like screening and vaccination as well. The middle band is where we try to support people who are actually at risk of, say, a long-term condition or at risk of fuel poverty. And we want to prevent poor physical or mental health, and we can connect people up to social prescribing, which will be able to help with lifestyle issues and those sorts of things. But we can also link people up with income maximisation, for example. For the top band, which this has a smaller population, but a population that already has a condition of some kind. And what we're aiming for here is access to coordinated care, or we might be aiming for harm minimisation. And our goal is to prevent the loss of independence, prevent hospitalisation, and indeed to prevent mortality. So that's the second of the models we're going to have in our minds today. And what we've done is pulled out a number of examples that we want to show you. So the first of those is around the Fair Work Charter. We'll be covering that towards the end of the presentation. There's also the work around the Shared Prosperity Fund, which I think my colleague Kate is going to take us through briefly. We're going to drill down into more detail around integrating health and wellbeing support for adults. Janice is going to update us, and I know you guys already know about this, on the Mental Health Transformation Programme. I'm going to cover a piece of work that Neve is leading on, which is Making Every Adult Matter. And I'm also going to cover the Pathways work, which comes under suicide prevention. So I think at this point, I'm going to hand over to Kate to take us through integrating health and wellbeing support for adults. And if you like, Kate, I can press enter for you.
Yeah, that would be helpful. Thank you very much.
Okay.
Brilliant. Thank you. So are we okay to go on straight on to the next slide, please, Eugenia? Okay, so I'm just going to go straight into the integrated health and wellbeing support for adults. Integrated health and wellbeing support for adults is about keeping people well. So when we're looking at that triangle, we're very much focusing on the bottom part of that triangle, recognising that everyone could have good health and wellbeing and helping them to stay healthy and well. Calderdale, as you know, already has various existing health and wellbeing support on a spectrum from informal groups, community organisations, commissioned lifestyle support services, supporting behaviour change and social prescribing. So we're thinking about anything from the knit and natter groups, tea dances, better living services, stop smoking, staying well, to name but a few. These currently support people to improve their health and wellbeing. However, this work and the purpose of the integration is about how we achieve better health and wellbeing outcomes for the people of Calderdale. And the outcomes listed on the slide are outcomes that were agreed amongst stakeholders across the system in January. You'll probably be familiar with some of these. Some of them are similar to the 5 ways to wellbeing. And stakeholders recognise that by supporting adults to improve these outcomes, we'll be looking at the ones that are important to them. So thinking about that person-centred approach. And this was a start of some public health led workshops that we've had across the system with stakeholders. And what we've done is to really think about as stakeholders what it might look and feel like for the people of Calderdale if we're very much going to have a person-centred approach and an integrated approach. Could we have the next slide, please, Eugenia? Thank you. Okay, so stakeholders also agreed very much what is in scope for this work. So obviously it could become quite large, and we agreed that it would focus on 3 functions. That's supporting individuals and groups to adopt healthy behaviours, connecting people to assets in their local community to keep them well, and stimulating and activating and supporting health and wellbeing opportunities in the local community, which connects in with the community-led health and wellbeing support and the UK Shared Prosperity Fund, which I'll come on to later. Stakeholders across the system have also agreed the ways in which we will work together to achieve this, and this is in line with the Calderdale Cares ways of working. So how can we better harness community strengths? We know if people feel better connected to their community, they'll remain independent, they'll feel empowered to care for their own health and wellbeing. And how we can ensure that support is inclusive and reaching those people that really need to benefit from this. So including those that are at highest risk of poor health and wellbeing. That support is seamless and based around what the individual wants and is important to that person. And that stakeholders work in a more integrated way. Embedding this in local trusted community organisations such as our community anchors like HOTS, North Halifax Partnership, Head and Bridge Community Association. And I think what we've learned through COVID about this is that local people trust these organisations and the great power that we've got in our communities to support each other. And then that funding is sustainable and based, I guess giving it parity to ensure that we've got longer term contracts with our VCS sector and parity with our statutory contracts that we hold. Could we have slide 3, please, Eugenia? Can I have slide 3, please, Eugenia? Brilliant, thank you. Okay, so this is where we're up to with the piece of work. On the left-hand side, what we've got is where stakeholders have agreed what we think it's going to look like to be a person-centred approach. What will it look and feel like? And then on the right-hand side, what organisations and services need to do, what we must do in order to achieve this approach on the left-hand side. We've also unanimously agreed that we're now at a point where we must co-design with this with the people of Calderdale, making sure that we include our marginalised communities and those who are at highest risk of poor health and wellbeing and existing users of health and wellbeing support. And this is very much work in progress, and the aim is that we'll have the model ready for the end of March. We'll then be clear on how this is going to be contracted. And we're currently providing a regular update to 3CPB, and I'm happy to come back and report on progress. And then how this links in with the community-led health and wellbeing recovery for Northern Halifax and the UK Shared Prosperity Fund is that third function about stimulating community development. And I'm sure you'll know that the UK Shared Prosperity Fund succeeds the EU structural funds, and it's designed to support the government level and up agenda. WIC is the lead authority, as you'll probably know, and it's going to be allocated over 3 years up until 2025. The UK Shared Prosperity Fund sets out 3 pillars, that's community in place, supporting local businesses and people and skills. And the purpose of the community-led health and wellbeing recovery in public health was about tackling inequalities, improving health and wellbeing outcomes, building back fairer, recognising that the communities that have been harder hit by COVID. So public health identified £500,000 from COVID recoveries monies to focus on those in the worst off communities in our north and central localities. By being community-led, we know that the purpose is to ensure that the community decide what is important to improve their health and wellbeing, giving over that power and making it easier for local people to get involved. And I'm sure you'll be aware the evidence over the years defines that community life, social connections and supportive relationships and having a voice in local decisions are all factors that underpin good health. And a Cabinet agreed in August, in line with the Council priority to tackle inequalities, given the current cost of living crisis, previous investment decisions and increased deprivation in some of our communities in Calderdale, that we will match fund the UK Shared Prosperity Fund, including the Community-Led Health and Wellbeing Fund, which equates to £5 million in total of investment, particularly focused in those most deprived, lower super output areas in Calderdale, according to IMD. So that's north and central localities. So we're thinking of Park, some of Worley, Ovenden, Illingworth and Mixenden. We know that 60% of the people in Calderdale who live in the 20% most deprived super output areas in Calderdale, which have the highest levels of unemployment, highest rates of ill health and poorest family income. So partners have recognised that we've got greater synergy that we can achieve by working together. And it'll not only improve the health and wellbeing outcomes, but meet those set by the UK Shared Prosperity Fund. So that's how it very much fits in with this agenda. We're currently at a stage where we're waiting for the UK Shared Prosperity money from WICA following government sign-off this month. We've had an initial meeting with stakeholders. We've agreed broad outcomes. We're currently establishing governance, agreeing year one priorities, and looking at strengthening our relationships with our communities as well. So that very much sums up my section of the presentation. I'm going to hand you back to you, Janie, and obviously happy to take questions at the end. Thank you.
Thank you, Kate. Just struggling to find the unmute button there. Right, thank you. Right, we'll continue now into the suicide prevention section. I don't know why that's not working. Apologies. There we go. Right, so the second of the areas we want to drill down into is on suicide prevention. So this is the topic that I lead on. Excuse me. So you will remember that the suicide prevention strategy has these 7 kind of elements to it. Sorry. So the first of those is reducing access to the means of suicide, to the means of suicide, tailoring approaches to improve mental health in specific groups, research data and data collection and monitoring, which is actually very, very central to this. The providing better information and support for those bereaved by suicide, because we know people bereaved by suicide have a higher risk of suicide themselves. Reducing the risk in high-risk groups, communications and engagement, and leadership and governance. So I'm just going to minimize the photos I've got over here, so because they're covering the screen. Right, there we go. So I'm just going to give some examples of some of the things we're doing. So in terms of reducing the risk in high-risk groups, I'm going to tell you a bit more about the Pathways project in a moment. We're doing a lot of work on high-risk places in Calderdale, and I'm sure some of you around the virtual table will have been involved in some of that. We have commissioned support from Leeds Mind. So we have a service which is a support service for those bereaved by suicide. At the moment, we're offering mental fitness sessions, which are particularly aimed at men who have a higher risk of suicide. We have, of course, our community mental health transformation program, which is trying to address the risk in high-risk groups. We're repeating suicide audit. So we're about to do that for the years 2019, 20 and 21. We're doing training right across the system for different professional groups. That's going to be led by Papyrus. It's focused on suicide awareness. And finally, we're doing some work around leadership and governance, which is essentially setting up a new suicide prevention strategic group, because at the moment we have a suicide prevention group that tries to do many different things. So it's doing a networking function as well as the strategic bit. So we're going to separate that out. And we're going to refresh, we are currently refreshing the action plan, but it will still have these 7 key planks. So just going into the Pathways project, this is where we're working with key agencies to understand what happens when someone is taken from a high-risk location to a place of safety. So what support is offered? The work is very complex, actually, because the pathways around that are very complex and there are lots of agencies involved. And in fact, we're piloting a new system through that piece of work, whereby we see the police asking mental health services whether the person that they've taken to the place of safety is actually actively receiving care from mental health services. That will allow us to identify those who are not. And over the course of this project, we'll identify gaps in provision, we'll sense check those with people with lived experience, and we'll make recommendations for service improvement. And so far, we have some themes coming out, which are around information sharing. So that one that I pointed to there is one aspect of that. There are capacity issues that are coming up. and whether the person has a diagnosed or diagnosable mental illness is coming up as a theme. And I just finally, under suicide prevention, really wanted to remind everyone, I'm sure many people around the table will be aware of this, that Calderdale is a signatory to the Prevention Concordat. And I wanted to draw your attention really to the first of those principles or commitments, to join the shift towards prevention-focused leadership and action throughout the mental health system and into the wider system. And, you know, that connects really well with the pyramid that I showed you before and the actions that we take across the different population groups. I'm going to take you through the third area that we're going to drill down into. Now, this is actually Niamh Cullen would be here presenting on this aspect, but she can't be with us today. So I hope I can do justice to what is a really, really important piece of work. But she has prepared the slides and they've got a lot of information. So hopefully that will help. So the first one is Making Every Adult Matter, so MEME as an acronym. And this work was born out of some work that I know you know about, the Burnt Bridges program or report. Now, the underlying idea of MEME is that people facing multiple disadvantage experience a combination of problems, including homelessness, substance misuse, contact with the criminal justice system, and mental ill health. They can fall through the gaps between services and systems, making it harder for them to address their problems and lead fulfilling lives. So MEME is actually a coalition of national charities, something I wasn't aware of. And whilst this program doesn't actually bring us funding, it does bring us specialist help. So access to training and that kind of support. And one of the aspects of the MEME initiative is the Unity Street project. So I'm just going to go into that. Again, you can see a lot of information there, so I'll let you scan that. But from what I understand from Niamh, this is quite a recently initiated project. The before photo on the left reflects what was happening prior to this initiative coming into being. This was an area that had drug dealing going on, where people were not consistently in contact with services. The photo on the right, as I understand it, is the same location during a recent summer fete, which was the idea came from, and it was designed by residents. So the whole project is based on a harm minimisation model. A safe community room has been established. It's supported by workers with lived experience, and you can see some of the outcomes there that Niamh has pulled out. Now, again, this is really this is impressive in the sense that it is very much a ground up initiative. So it's come from the ground and been built. It's a resident-led initiative, and I understand that the landlord who's involved has become a true community asset. So as well as those three examples, we wanted to touch very briefly on two highly relevant system-level programs. So I'm going to pass to Janice, first of all, to update you on community mental health transformation, and then to Marie, who will update us on healthy workplace initiatives, and then we'll open it up. So I'm passing to you, Janice, now.
Thank you, Eugenia. Thank you. So I'm Janice Wutter. I'm the Old Age Programme Lead at Calderdale. And just in the work that we continue to do around the community mental health transformation. So just as a very quick reminder, the focus of this is really looking at working quite differently with people who've got complex mental health needs, really focused around increasing access, removing those barriers, kind of ensuring there's no wrong doors and we're not losing people through gaps as people are trying to access, and there's multiple entry points. So the work has really been kind of looking at how we bring these pathways together, kind of moving away from the primary care, secondary care element of things where people are getting lost. What we've focused around is kind of some new clinical mental health roles at a primary care level, and how do we move to a much more integrated offer closer to home for people. We're kind of developing and piloting alongside Imperial College London a very kind of specific household model, population health model within each of our PCN areas. And that's kind of really a very, very kind of community-based, very empowering kind of person-centered approach, which also kind of really connects with those wider social determinants, which we know are so incredibly influential on kind of people's building their resilience and maintaining their mental health. We're also kind of working really closely with the work that Kate's kind of described earlier. So a lot of the work we're doing is about kind of working at a system level to integrate the numerous programs of work, and ensuring the different strands that we're aiming to achieve is really kind of closely kind of connected, and we're building and sharing kind of knowledge bases and obviously the resources we've got. We're also kind of starting to build some real kind of skill sets at a primary care level. We know that's really important. So we're kind of starting to do some alignment around how we bring the various skill sets that's really important to people, and actually what makes a difference to improve the individual outcomes and people's experience. So we've kind of started a lot of work over the last few months beginning to build those kind of MDTs, those multidisciplinary teams, the different skill sets, and the ability to communicate and have a much more kind of aligned, streamlined service. So we don't have to keep having multiple assessments. So the aim is to kind of do that in a much more streamlined way. So that's a very, very brief summary of the work that we've been doing, but it clearly aligns with multiple programs. Happy to take questions later. Thank you.
Thank you, Janice. I'll move on to Marie now. Thank you. Oh, it's again not letting me do it. Sorry, I don't know why. There we go.
Thanks, Eugenia. Hi, everyone. Marie Conway from from Public Health Improvement Manager. So we're all aware of how important good work is on people's physical and mental health. So I was really pleased to see, and which I'm sure most of you are aware of, the West Yorkshire Fair Work Charter, which was being brought in and led by Tracy Brabbin. Now, the aim of that was to really sort of set good standards of work across our region. And what she did was set up a steering group with lots of leaders and experts representing a wide range of factors to develop the charter. And what they identified was that there was 5 key aspects that an employer should offer for fair work. I think what's good about this charter is it really captures all those determinants. Lots of other charters just tend to focus on sort of being more active and looking at healthy eating, etc. But this really looks at other things. And those 5 key aspects, briefly, one was around sort of opportunity, which is about inclusive pathways into employment and career progression, and also really importantly, inclusive recruitment practices and flexible working arrangements wherever this is possible in local businesses and organisations. Security, and this was about, again, these are also important, and you know, we look at them and think actually these should all be in place, but unfortunately we know in some businesses they're not. So that's about fair pay and fair working conditions, and actually safe working conditions where people are free from bullying or harassment or discrimination. The other one, well-being, which is obviously the big part of this well-being outcome. So workplaces that foster good physical and mental health and support for wider aspects of well-being, especially things like personal financial health, which we know is so important now with this cost of living crisis. The other one is employee voice. So that's about really consulting, engaging with employees and making sure that everybody's got an opportunity to contribute to that and in making decisions. And that staff representations, that the networks are really supported, involving employees with different characteristics so that they have a voice. And then the other one was around fulfillment. So making sure that employers are offering learning and development opportunities for everyone, and that people are having regular, meaningful sort of one-to-ones and performance management, and also sort of including opportunities to support other organisations and doing some work with, for example, volunteering with non-profit organisations and the voluntary sector. So what happened was a consultation has been carried out with all types of businesses, and that's just been produced. The results are just being produced at the moment. So we're going to look at that, what that means for us locally. We've also got one of our public health colleagues who's doing a dissertation on this and is actually speaking to our local businesses to find out what this charter means to them and whether they think it's achievable. There's lots more information on the link, which you're welcome to have a look at, and I can take any further questions. So some other things that we're doing within Calderdale, we want to encourage businesses to become age-friendly employer, and there's a charter there that shows resources and shows what we're looking for to try and encourage businesses to support those older people in the workplace and also recruit. We know that there's recruitment issues at times with people not recruiting older people. And then other things that we're looking at is we want to sort of co-design a business event in spring to engage with local businesses, to really talk to them about this outcome that we're trying to achieve, to share some good practice, bring in some businesses that are doing some really good work around mental well-being and identifying any support that they may need. The other thing we're looking at around prevention, developing and training workplace mental wellbeing champions. That's going to be an action as part of the Suicide Prevention Action Plan when it's refreshed. And I really welcome that, because I think we're all aware of how much value champions of the workplace can be, especially those with lived experience, so people have got somebody to talk to. Eugenia touched on this earlier, the state of minds awareness sessions. We're getting some fantastic feedback about those. So we've been offering those to local workplaces and organisations. For example, our Calderdale police colleagues are taking part in that quite imminently. And as you will be aware, they do have to deal with lots of situations where they're coming into contact with people who are suffering with mental well-being. And in terms of sort of more focused work to address those health inequalities, we're also doing some engagement work with workplaces that are at higher risk. So for example, sort of based on local insight, we've skilled up some of our local place development workers. These are staff that go out and talk to local businesses. So they've built up some really good relationships and some trust. And what we've done is we've asked them to go out and talk to some local businesses. Specifically in the last couple of weeks, they've been to an area where they experienced a suicide, and they're just starting some conversations with those employers around how staff are around the mental well-being, and also offering them those state of mind sessions as well, which quite a few businesses are interested in taking up. So that's just a really brief overview of a snapshot of some of the work we're doing there, and happy to take any questions later on.
Lovely, thank you.
We've got some questions for you now.
Thank you, Marie. And you can see that, oh, what have I done? Sorry, I've just get us back to where we were. Sorry about that. So yes, now we're going to really pass it back over to you, but I've just got a couple of slides just before we do that. So we wanted to pose the question, how can the Health and Wellbeing Board support this work? And Deb's asked me to just put this slide up, which is from the Wellbeing Strategy. You'll know it well, but just to, as a reminder of the things that we said, the kind of how of what we'll do. So we need to apply our agreed ways of working to this complex issue. So by joining up services better, I've really picked up all the references to No Wrong Door, which really is very much part of the Pathways work as well. A focus on prevention, addressing health inequalities, of course, and empowering communities so that they become resilient. So the questions that we've posed, we have 4 questions here. Excuse me. The first one is, what are you, your organisation or your sector already doing to promote good emotional health and well-being and prevent suicide? Excuse me. What else will you do to increase good emotional health and well-being and prevent suicide? In light of the challenges and constraints that we all face, how do we maintain a focus on those things? And what would you like to see happen next to achieve the goal that we've set out today? So now I'm going to, I think I'll, perhaps maybe I'll leave those questions on the slide, on the screen, but over to you, Chair, to see how you want to take the rest of the discussion forward.
Okay, thank you. So it was quite a long presentation, and I mean, obviously, I'm sure that members have followed it through. It was all quite logical, but there was a lot of information there, and just trying to keep the overall context and sort of what is the approach. The last slide that you shared, which took us back at Deb's request to the well-being strategy and this part of the life course. And the approach, those 4 bullet points that you mentioned in terms of how we are trying to approach these different challenges of the life course, help to give it a bit of context. But I do feel almost like a summary is required. But is everybody feeling comfortable with what's been shared in terms of that first level of understanding, just getting a grasp of everything, or is it clear to everybody before we start looking at questions? If it's not, I guess there might be some questions just initially back on what's being shared. Yeah, so Councillor Wilkinson, please.
Thank you, Chair. Yeah, just a couple of comments and perhaps a question as well, really. So Kate spoke about being connected to your community and how important that is. And you know, a lot of our most vulnerable residents in Calderdale, you know, are quite heavily reliant on voluntary sector organisations and community organisations. And I know that some healthcare professionals as well sort of refer people to those organisations or sort of signpost them. But a lot of them are sort of really struggling right now in terms of funding with their sustainability. So I think that point that Kate made about having longer term and sustainable contracts is absolutely crucial. I have visited a number of our voluntary sector organisations recently that are sort of really, really worried about what the future might hold. And then the second sort of point I wanted to make was around addressing the core determinants of health. And you know, when we think about things like affordable warmth and anti-poverty and income maximisation and everything that's going on at the moment with the economy and inflationary costs and energy bills rising, you know, that it's an increasingly challenging picture for us all and for our most vulnerable residents in particular. And I think that just makes our job of preventing poor mental health that bit and physical health that a bit more challenging. And of course, this is against the backdrop of sort of health and social care services that are also under increasing pressure. And as I said, the voluntary sector. So I just wonder whether, you know, the goals that we set ourselves about sort of reducing poor mental health and suicides, obviously they're noble ones and they're ambitious ones. I just wonder, are we likely to succeed in achieving those goals, or are we setting ourselves up to fail? Because I do feel like perhaps we're more going to be sort of firefighting over the coming months with everything that's going on. So just a thought there, sort of question about whether what we're hoping to achieve is realistic given what's coming down the line. Thank you.
Thank you, Councillor Wilkinson. Yeah, so we're going to take some comments and questions and then pull them together, and then we'll come back to the presenting team. So questions there about funding and challenges of the VSO community. Are we addressing the current challenge of the energy and cost of living crisis, which is wasn't particularly mentioned in there, but of course that's something that's impacting on everybody in Calderdale, particularly the most vulnerable. And are we setting ourselves up to fail? Are we going to be doing more firefighting rather than being able to achieve these goals? Councillor Scott Patient, please.
Thank you, Chair. I mean, initially, just similar points to what Councillor Wilkinson just made, and I don't think it'll escape any sort of local elected members to understand that the voluntary community sector is already hugely put upon, and I think pressures on council budgets are only going to exacerbate that in terms of them being asked to do more potentially than they already have. Clearly, we know the work that they do and have done throughout COVID, and also groups here that have had to suffer flooding and how that's affected them. But I guess more broadly is in terms of the VCS is the fact that there are some groups, just those kind of peer support groups, that won't necessarily be affected by that just pop up. But I think some of the sporadic nature of how some of the VCS works is almost like the challenge in and of itself. And I wonder if we are doing enough in terms of that shared voice lobbying aspect of really thinking, looking towards West Yorkshire, looking towards the ambitions of Tracy, but also looking towards government in saying, here are the challenges that are facing Calderdale. Here's what needs to happen so that things are a bit more linked up, because I do fear at the moment there is so much sort of, as Adam said, like firefighting going on in terms of just keeping on trying to manage what's happening, especially in light of the cost of living crisis, and thinking about how they're going to continue to run their fridges, where they're providing food or lighting and all these various challenges. So that kind of shared voice lobbying aspect, I think, really needs thinking about at a core level, because continually trying to exist in a sort of vacuum of not being able to share and collaborate effectively is going to be a concern going forward.
Okay, thank you, Councillor Patient. So something about sort of the voice of Calderdale playing into regional and national discussions through the ICB, Calderdale Cares Partnership Board, and other fora as well through the Mayor for West Yorkshire, and how we can ensure that we're clear about what the challenges are in Calderdale, and we voice those clearly in other settings. Penny, please.
Yeah, thanks, Stephen, and thanks so much, colleagues, for that presentation. There's a huge amount of information in there, and really some really important points. I think I was going to go back to that raising the awareness point of the vast and diverse range of programmes and activities that are going on here, and take up the offer, I think, for the Clinical Professional Forum, that we consider elements of this presentation and think about the first question, Eugenia, that you asked around what you doing, what's your organisation doing, how could you help support the ambitions. I think we've spent quite a bit of time in the Clinical Professional Forum in the treatment space, so in the element that Janice presented, but I think there is a real opportunity to raise the awareness with the members of that group around the broader aspects of this programme of work. So, just like to extend the invitation, and we can talk about it a bit more in the forum, if that's okay.
Good idea, Penny. I think that we'll take up that offer for sure. Councillor Hutchinson.
Thank you, Chair. I don't know why I was surprised, but to see that nearly half of the working age population do not have good mental well-being did come as a shock to me, particularly as so many of those people are going to be living in families with children, and the impact of that poor mental well-being amongst the parents on the developing children must be very, very significant. So I'm just a plea to make sure that when we are trying to improve well-being, mental well-being, we're looking at it as a family, from a family basis, rather than just as individuals, and whether there's anything going on here that would that would support that approach.
I think that's a critical point, Councillor Hutchinson, and you know, we can't dissociate members of the family. It's a unit, and if you have a healthy family, then everybody thrives in that situation. Also, have networks of families working together through our communities as well. Very important point. Councillor Evans, and then it says S555. I don't know how to introduce you, but then if we go back to the presenters to see how we can start to address some of these questions and comments that have been made. Councillor Evans.
Thank you, Chair. Yeah, I mean, some absolutely excellent work is clearly being carried out here. There's some very good work going on. My worry about this sort of situation is all of those things which Councillor Wilkinson, Councillor Hutchinson have raised, Councillor Patient. I agree with all of those issues. On a more sort of detail basis, is there any way that we can look at baseline assessments of where we are in these various areas and what progress we're making, whether we're setting targets for things, whether we know whether we're achieving them? Clearly, there's lots of really good work going on, which is fantastic to hear and really, really important. I suppose I'm sort of putting my scrutiny hat on here and saying, is it possible in some way to put data on this and see what progress we're making, set ourselves targets for achievement, where we're going to get to by when, and whether we're achieving that, and whether there are other things we could and should be doing to enable that. But as I say, there's some wonderful stuff going on. There was also a reference to the Burnt Bridges report, which is something that absolutely shocked me when I first came across it. And it emphasises the multidiscipline nature which has come out in this presentation, which is important. But I think what it also did, the Burnt Bridges report, was to emphasise the importance of coordination between the various organisations. There are a number of people here doing various things and working in other areas, and it's about coordination. So I suppose from my point of view, excellent work going on. Thank you for all the work that's going on. Is there some way we can measure our achievement in relation to our very worthy targets, but on a more, I don't know, statistical, numerical basis, to see whether we're getting where we need to go, and also just to make the plea for ensuring that we have good coordination between all of these organisations which are doing wonderful things, and that we don't waste efforts by overlapping. I say waste in a positive sense there. So in terms of where we're going, how we're getting there, what we're achieving, where we're getting to, and ensuring that we get coordination between each of these areas, which is so important. Thank you, Chair.
Thank you very much, Councillor Evans. So 57% of the working age population report good mental health. So as Councillor Hutchinson mentioned, that's 43%, which is a huge number, that are reporting poor emotional or mental health. So when do we measure that? How do we measure that? And how can we see a trajectory, an arc of progress on that over the coming months and years? And then 15.6 suicides per 100,000. So again, a graph, a trajectory, and other things that we're doing having an impact on that. And then of course, the all important thing around coordination and integration of services, so that we're not working in pockets and in silos, and different assets are working together and building on what each other are doing. Good points there to be addressed, hopefully after Kath has come in. Sorry for Kath, I didn't recognise you. Thank you.
Thanks, Chair. So I'm for those of you I haven't met yet, I'm S555, also known as Kath Cormally. I'm the new Director of Adult Services and Wellbeing in Calderdale Council. So just wanted to say, I think it's an excellent presentation. So thanks to Eugenia and colleagues. And I think there is a lot of information in there. But for me, it's kind of bringing it to light, that kind of core really poignant issue of the increase in mental distress and emotional distress and trauma. And I think what brings it to light for me is, kind of looking at those social determinants and the impact that has on people's physical and mental health, excuse me, that we're seeing on our TV screens every night. So I think it was last night, there was a very poignant report on a woman who's 65, who was a cleaner in Sunderland. I don't know if people saw that, who was in tears because she could no longer afford to make a slice of toast. She was frightened to put the toaster on. And so I think for me that, kind of really drives home the difficulties, but also the opportunities of supporting people together wherever we can, and actually working in partnership wherever we can, and being really aware of those social determinants and that potential harm that people and our communities are under. So I think there are I think it's also an opportunity, because it is absolutely showing us, putting the spotlight on prevention and actually bringing that to light, what that actually means. So preventing and delaying, kind of harm and the need for care and support that people who are kind of currently on our TV screens, we don't want those people to suffer further harm and be at risk of suicide and further mental distress. So I think, like Penny said around the kind of clinical work, I think there are opportunities where certainly our adult services and clinical services in the community can work much more in partnership and in a different way with our kind of health and wellbeing colleagues and public health colleagues as well. So I kind of welcome that conversation to what we can do further and faster, really. And again, comments about supporting our voluntary sector, absolutely right. Thank you.
Thank you, Kath. So an offer there to bring this conversation and to give some energy and impetus to it, and support from the director there. Thank you very much, Kath. Neil, finally, and then I don't think we need to come back for responses as such, just to make sure that all these points are being noted and it's been taken into the work, but we'll come back to the presenters for some further comments. Then we're going to spend probably 10 minutes or so looking at the specific questions. Neil, please.
Thank you, Chair. Thank you for the presentation. I do know all comments so far. I do also think we've missed the trick as large organisations within the health and wellbeing system. We employ huge members of staff, and we've not talked about what we do to support our staff in these sort of situations. So I just wanted to reflect what we do as an ICB with regards to our staff. We've employed for a number of years mental health first aiders to help signpost people around the system. We do a lot around staff wellbeing, as I know organisations do. But I think we should lead from the front on this as organisations. I do get the lobbying and everything else, but we do need to promote what we do to our employees and what isn't available. As the hospital employs 6,500, the ICB employs 1,300, the council works employs significant numbers, and if we lead on that and we promote what we do, then others should also follow, because there's a lot to do with other employers within the system, as well as just the voluntary sector. So I don't want us to miss what we all do as employers, and we should capture that and recognise what we do and build upon that.
Excellent. I agree. And what we do is we try to set a good example and set the tone for how employees should be cared for, nourished, nurtured, and empowered as well in their workplace. So any learning that we can take from our largest employers needs to be obviously then fed in. But maybe there are things that they also need to, and we all need to be learning as well. Okay, so a number of different points. I hope they've been noted by not just the note takers, but also by the presenters. Is there anything that particularly jumps out to your presenters of the things that are being shared that you think needs to be featured a bit more strongly in what you're already doing amongst all these wonderful initiatives?
Yeah, thank you. I'm happy to make a couple of comments. And colleagues, please, follow me if you'd like to do that. But just taking the comment that was just made, actually, about the public sector really as employer. and the opportunities that we have there. If you think back to that pyramid diagram, you know, that's that bottom bit, isn't it? There's such opportunity to support people to stay healthy, and I you know, really welcome that. It actually does answer, it does respond to one of the first questions I posed back to you. But just generally, we will certainly take all these comments back. So I've been noting them down. I know my colleagues will have been, and we've got this recording. So we absolutely will. There's some really brilliant stuff here. And if I could just pull out a number of themes that I've picked up from the comments and questions you've raised. One is about the likelihood of meeting our goals. And I wanted to link the comment made by, if I've got it right, it was Councillor Wilkinson, I think, with what was made by Councillor Evans, because actually I think we possibly could do a bit better at drilling down to disaggregate those targets to see how we're doing. So I think, how realistic is it? Well, obviously there are some challenges. Let's get a bit more sophisticated about monitoring. So I think that was a really, really helpful point. Lobbying upwards, I think, is absolutely right, and I think sort of lobbying sideways as well. So one of the reasons we pose the questions that we have today is to really to ensure that the people around this table who have great influence in your own spheres can take this, the message of prevention, because we really mustn't let it get lost. And that is the danger when there are economic constraints. You'll always have public health talking about prevention. So that's one thing. But I think it's absolutely right to keep flying the flag for prevention and health inequalities as well, actually. What else have I written down here? I think, yes, we've had a couple of offers from members around the table to take these conversations on to other forums. So please do, and please come back to us if you'd like us to help you with that by coming to present or whatever. And I think another one that was mentioned was around coordination. And I think, thinking back at this, listening to the presentation in a way, I'm struck that we are very much focused on getting better at coordination, making sure there's no wrong door. So we are focused on that, and we will certainly keep doing that, as it's so important that there is no wrong door, and that we are working in synergy together in the most effective and efficient way. Colleagues, was there anything else you would like to add? Kate or Marie or Janice?
Can I just come in very briefly? And I think it was pertinent to the point that Councillor Wilkinson made about the stability of the VCS. And I think we're all going to face financial challenges, aren't we? But the VCS, I think at the moment, that is already becoming, I think, quite a key point in this work, isn't it? We're so reliant on the VCS, particularly at this grassroots level. I do have concerns around that, and whilst some of this work will address the stability for some of our VCS organisations, it won't do it for all of those organisations. And I think I've seen Julie Robinson on here, who's Chief Exec of BAC. I don't know if she's around on here, but I know that there's a questionnaire gone across the VCS organisation to ask about the financial stability of the VCS, and I wondered if that work had progressed any further.
Thank you, Kate. Sorry, Julie wants to come in there. Thank you, Julie.
Hiya. Yeah, just to update you, we have just started to rerun the survey with a bit longer lead time, so we can try and pull all these strands together. And top and tailing it really with some work that the Community Foundation have done also. So we're just rerunning the survey, and we've got it on the next agenda for Health and Wellbeing both to bring a report back there.
And there was a mention of the UK Shared Prosperity Fund. Was it 500,000 for Calderdale? Did I get the numbers right there?
So there's 500,000 public health money been found, but there's also some other match funding. But in total, with the UK Shared Prosperity Fund, there is £5 million worth of funding. which will be over 3 years up to 2025. But it's been agreed by Cabinet that that will very much be focused in the lower super output areas in our worst 10% of lower super output areas, according to IMD in Calderdale, which is about 5 local super output areas in North and Central.
Sounds like a very technical term, lower super output areas.
It's a definition by a head of population. I'd have to go back to exactly how many in the population, but it's a smaller area than a ward area.
Yeah, okay. And it seems, before Marie comes in, that population health management, which is obviously an approach that I think we're all familiar with, it aligns with sort of the Unity project and the Gathering Place, targeted interventions and support and any engagement with individuals most at risk. So of course, if we have a broad brush approach on trying to improve suicide rates or reduce them, of course, as improve would be, or improving the mental health and emotional well-being of the working age population, we need to know where the pockets of unhappiness, of despair are, of challenge, and address those rather than a broad brush approach across Calderdale, because 5,500,000 across the whole of Calderdale will have far less impact than it will on pockets in these high super output areas or particular employers with particular challenges. Marie, and then we'll come to these questions, spend a few minutes on them.
Thank you, Chair. I just wanted to come in on Neil's point. I think he raised a good point about there's lots of really good work going on around wellbeing in some of our larger organisations like our NHS, councils, etc., where we've got some really good occupational health support. We've got lots of policies and procedures in place. But I think there's also a real opportunity for us to share that resource with some of those smaller businesses. We know that a lot of those smaller businesses and like manual workers, etc., are at a higher risk of poorer mental health and physical health. So I do think we've got at place a real opportunity to almost sort of for the larger organisations to sponsor a smaller organisation and work together and share, you know, so that some of the smaller businesses can access, for example, their occupational health services, or, you know, that might not be the best example, but there's certainly resources that can be shared and support for bigger organisations that are doing really well, like those mental health first aiders. Could they also be involved in training some of those smaller businesses that don't have funds and opportunities to do that? So just wanted to sort of say, agree with the comment, but I think it's an opportunity as well for us to share that knowledge and resource and experience that we've got.
It's a very important point, I think, because small businesses very often don't have the capacity and capability to offer many of these services, the experience in doing it as well, and just the time and headspace to address them. So where, you know, small practices, for example, in, you know, primary care from my background, we've never seen such high sickness rates. But how do you then address that is a major challenge. Janice and then Councillor Evans.
Okay, just wanted also to mention there's the at the moment, we're just completing a process around some grants funding for emotional health and well-being initiatives, really at a grassroots level. So that's been undertaken with Community Foundation. So again, it's about promoting at a real grassroots level some kind of focus around resilience and kind of working with communities. So just wanted to mention, I think we've been the response rate has been unprecedented. So we've had significant kind of applications, which is great opportunities and a challenge in terms of how we allocate the funding. But just wanted to kind of remind people of that opportunity. Thank you.
Okay, yes, sort of navigating that system and funding and resources. I suppose that's VAC's job, isn't it, Julie's job, but really to help all these community organisations and assets to access funds in the most propitious way. Councillor Evans.
Thank you, Stephen. Yeah, really just moving on to the questions which Eugenia quite rightly posed to us as members of the Health and Wellbeing Board. What are we doing? What should we be doing? And so on. If I put my councillor hat on, we make an attempt in our ward to signpost, I suppose, people to help and support in these problem areas for them. I have to admit that that's rather ad hoc at the moment. So perhaps if we were to do, we could do a better job of signposting people, but perhaps we need some form of data pulled together, what's available, how it's accessed, so we can effectively signpost people and be part of the process of directing people to where the type of help they need or the assessment they need is available, and enable that to happen more effectively. So hold my hand up and say, we could be doing more, we should be doing more, but perhaps some added more detailed information, but in a simple bullet point format, would help us to achieve that. So yes, we should do something. Please, can we have some help with doing it? Thank you.
That's a very good point. Yeah. So, I mean, thankfully, access into emotional and mental health services are universally now self-referral. Anybody can refer, a friend, a family, a carer, an individual, a young person, a parent. So there shouldn't be any barriers, and that's both to primary and specialist services as well. But I think we need to get those messages out to the community, to the different organisations, so that we know very clearly how individuals can access this help and support. Anybody else on these questions then? I think we've touched on what some of the organisations are doing around the Health and Wellbeing Board table. What else could we be doing? In light of the challenges, how do we maintain a focus on emotional health and wellbeing and preventing suicide? What would you like to see happen next to achieve these goals? Councillor Hutchinson.
Thank you, Chair. Through scrutiny over a number of years, a recurrent theme has been the difficulty experienced by people who have a combination of a substance misuse and mental health disease, that we haven't succeeded so far in having a good dual diagnosis service. People are batted backwards and forwards because they don't fit into the inclusion criteria for either mental health services or substance misuse. And I would really like some reassurance that we're on with coordinating, with bringing that kind of integration as a reality. Because as I say, I've been aware of this for at least 5 years as being an issue.
I think you could add another 20 years to that 5, Councillor Hutchinson. It's been a problem as long as I've been a GP in Calderdale. I think the barriers are evaporating though through the self-referral and also through communication between different agencies. But I think that signposting and one door into services needs to be strengthened, and a consistent message, so that, because these individuals are frail and vulnerable. If they get no at the first door, well, my experience is that they give up. Very important point. I hope that can be taken and noted. And I don't know if there's anybody who wants to just say anything about that from the individuals who presented.
Thank you. I'm sorry, I couldn't find the button for raising my hand. Yeah, I know that certainly in the pathways work we're doing around suicide prevention, we are looking very closely at that to make sure that there is no wrong door. If you have what is sometimes called dual diagnosis, is now tends to be called co-occurring conditions, but it's the same thing. I know also, and one of my colleagues might be able to remind me of the name of the national programme, but it escapes me at the moment. But I know that there is some new funding coming down around support for there's a national drugs programme with additional funding coming now. So the last time I asked this question, I was reassured that actually there will be an additional focus on trying to solve that. So I'm sorry, we can certainly come back to you with the details. I don't have them to hand.
Okay, thank you very much. Maybe finally, we'll take Janice then on this item.
Yeah. So it just really to kind of build on what Eugene has just said. So there are opportunities through the kind of transformation work to kind of look at how we kind of build these connections. Because as you said, the aim of this is to kind of ensure that when people present, their whole needs are able to kind of be supported and we build those connections. This is not about passing people from one service to another, which is actually what we know has been historically the case. There are some real challenges with it, but I think it's that assurance that we are clearly looking at how do we deliver something what's actually more joined up, meets people's needs, and enables people to actually have a better experience and better outcomes, because that's actually what's going to make a difference to people.
Excellent.
Okay,
That's
thank
fantastic.
you.
Yeah, thank you, Janice. Yeah. Okay, so I think we probably can wrap up at that point. I think that the main points that appear to have come out are about sort of clarity about what are our organisations doing and sharing that best practice around well-being in the workplace. Funding and funding for the voluntary and community sector, because we're expecting so much of it. Integration and coherence of the services that are available, and clear messages about how we can help and support and publicize what's going on and champion what's going on. And I think finally, let's see a clear arc of progress towards those goals that we've set. Thank you very much, everybody, for comments and questions, and to the presenters and for all the wonderful work that's going on. But we need to move on with the agenda, if that's okay. We're on to... Thank you very much indeed. Thank you. Okay, so we're on to Calderdale's Climate Action Plan and consultation. Again, obviously, it says Director of Public Health, but Debs isn't here. I'm hoping that Councillor Scott Patient and others will be able to help with this item. Who's leading, please?
Hello, Chair. I think I'm down to lead this item today, if that's okay.
That's fantastic, Sam. Thank you.
So yeah, just for the people on the call, I don't know, I'm Sam Saxby. I'm Green Economy Manager at the Council. So I've been working with the Climate Partnership and with Debs, our Director of Public Health, on the plan. I think you've had a paper on the governance, which is a really great background, but I've actually got a short presentation on the Climate Action Plan, if that's okay. It won't let me share until the previous presentation stopped sharing.
So sorry, I'm going to stop sharing now. There you go.
Thank you. Lovely. Okay. Fingers crossed this all runs smoothly. Is that coming up for everyone?
It is.
Fabulous. Okay, so yeah, this is really just going to be a brief overview and trot through the Climate Action Plan. I'll try and flag up some of the key items, but obviously that the plan itself has more detail in. So yeah, just to remind us all of the context, unfortunately Calderdale is particularly vulnerable to climate change because we have flood risk in the valley, and I think this summer with the high temperatures and the wildfires also kind of highlights another type of climate risk. So I think there's a feeling here in Calderdale, and actually a kind of growing feeling and a sentiment in the UK and worldwide, that we've really got to act now on climate to protect our communities from future kind of possible worse impact of climate damage. In terms of our climate journey, you know, we're actually standing on some really solid foundations. So we declared a climate emergency for Calderdale in 2019. In 2020, we set targets in line with climate science for what needs to be done in terms of the action that needs to be taken at the right scale. And they're to be net zero by 2038 with significant progress by 2030. In 2021, we modelled an emission reduction pathway, which was kind of like a technical piece to look at what technologies there are that can help us get to net zero, what's market ready, how they could be deployed, and how that could reduce carbon emissions. And then in 2022, we developed a climate action plan based on the emission reduction pathway and based on the targets. So in terms of where this work is coming from, it's very much led by Calderdale's Climate Action Partnership, and a couple of people on the call are in the partnership today, so this all will be very familiar things to you. But just to recap for others, the Climate Action Partnership has cross-party local councillors. It includes some partners like Together Housing, the NHS, and community reps like Slow the Flow and Friends of the Earth. And we had working groups for the Climate Action Plan supported by expert officers from the council, so it kind of brought in lots of technical information and knowledge. And the partnership have written the draft Climate Action Plan. We're currently asking for feedback on the plan. So we've done that co-production stage, we're in consultation. And when the consultation finishes, we'll redraft the plan and then seek to kind of adopt it as our plan for Calderdale. And when we've got that final plan, I imagine there'll be all sorts of engagement we want to do to spread the word. But for now, we're really in this consultation phase, trying to find if the plan has got the right things in it, if we're missing anything, and if we're choosing the right priorities. So the plan is an initial 3-year strategy, and the feeling was it needed to focus on that kind of short-term picture to work out things that would make the biggest difference and set us up for more future change. So it's grouped into 6 themes. Each theme has got case studies, it's got specific targets that we propose committing to, and it's got examples of things people can do now within that theme to make a difference in Calderdale. I'll go through each of the themes in turn so you have a bit more of an idea of what each of them really means. So first up, we've got shared voice. And shared voice really is about looking at how we work together to inspire and champion action, because this isn't just a problem here in Calderdale, it's global. So we really want to be able to collaborate and influence locally here in Calderdale, but also regionally in West Yorkshire, regionally in Yorkshire and Humber, and even nationally. And we also want to help key organisations in Calderdale embed climate action into everything we do. There's a recognition that there's a lot of big players here, and actually if we all act together in concert, that's much more powerful than any one person trying to do something on their own. The next theme is community climate action. And this really sets out a vision for how we'll work with communities to inspire positive action and also to celebrate the amazing projects that communities are already doing. So 2 of the key actions from this section were to launch advice hubs so that people would have a place they could go to and get independent, impartial advice to help them on their low carbon journey, and to support communities to take action and to define for themselves what's important in terms of climate priorities, and then to be able to do projects that will make a difference. The next theme is warm and resilient buildings. And this is really all about making every building in the borough warm, resilient and low carbon to reduce energy bills and improve health. So as a group, you will very much understand the impact that cold homes has on health outcomes. And in the cost of living crisis, I think everybody understands more than ever actually how much fossil fuel our buildings are using to stay warm. And actually there is this massive need for retrofit to insulate buildings better and to switch to cheaper low carbon heating technologies. So some of the key actions for this theme are to build the financial foundations for retrofit, because I think there's a really big recognition that it's difficult to do at the moment and it can be very expensive. And similar to the previous slide with community action, we really want there to be places people could go to get trusted advice on what the right solution is for their building type and on what the financial solutions are, to be able to kind of go and look at what good looks like and see an example of that themselves. The next theme is green economy. And this theme is really all about trying to think about how we can make the most of this green transition, because we're looking at new sectors, new skills needs and new jobs and technology. So the key actions here really are around growing green jobs and skills in the borough so that people can find a local supplier and a local business to help them, and to celebrate that business innovation that's part of the solution, and that these growth businesses actually will deliver zero carbon with us if we can just support them to get started. The transport and getting around theme is next, and this is really all about recognising we've got to improve transport choices so that people can get to where they need to go without needing a car. This will have a kind of secondary impact on pollution and hopefully on kind of activity levels. So some of the key actions here are around developing a strong voice on public transport decisions so that public transport works for people, it's a good option, it's affordable, and about listening so that we can create streets for everyone across Calderdale, for young people, for older people, streets that work and don't just feel like car parks, which some streets unfortunately do at present. And then the land and nature theme. This is about thinking about how we can restore and create wild places not only to reduce flood risk, but also to protect plants, animals and insects. We've got some really interesting habitats in Calderdale and some really, nationally significant populations of really endangered species. So the key actions here are to create an ecological emergency action plan as its own distinctive thing in 2023. And particularly to restore peatlands, which are huge in terms of having potential to absorb carbon and also support reduced extreme rainfall and slow the flow. Just to let you know about the structure of the consultation, we started on 21st of September and will be open until 20th of November. There is a questionnaire online alongside the draft action plan, but we've also got a partner pack and materials for discussion groups. And there's a communications plan in place to try and make sure we reach out to the diverse makeup of the borough. We really want to talk to people in every ward, people of different ages, different socioeconomic groups, different ethnicities, people with disabilities. We really want to make sure that we hear from everybody and we get their views on what is most important to prioritise in terms of climate action. The partnership itself is currently looking for new members, particularly reps from the voluntary and community sector and business reps. And we're also intending to set up delivery groups to work on each of those 6 themes to really look at how we unlock projects and how we accelerate progress. So if you're interested in that, please let me know. And I think today we thought it might be useful just to really get your thoughts on if there are any key groups or stakeholders that you can help us to connect with or contact, and if you can do anything to help encourage people to respond to the consultation. Obviously, it would be brilliant if you yourselves did respond to the consultation and tell us what you think. So I've tried to move through that quite fast because I know you've got a busy agenda, but I'm very happy to take questions and pause now for a discussion if that's something you have time for, Chair.
We definitely have time for the climate emergency. Otherwise, we're going to be in trouble. So, Councillor Scott Patient wants to share something. I think we've probably got at least 10 minutes for comments and questions. Please, Scott.
Thanks, Chair, and thanks, Sam, for the presentation. I kind of know that one well already, but it's good for everyone else to see. I guess there's just a couple of extra sort of questions within there. Well, a question and a comment. The other question I think to add to it is, are there any events that are coming up within the period of the consultation that you think would be helpful for us to get involved in? Myself and Sam and other officers have been going to real life events as well as Zoom events like this. So if there's any of those in your diaries that you think might be relevant. And I guess just the second point is as well to encourage organisation-wide admissions in terms of the draft climate action plan as well as individual as well. I think both will be powerful. So just to make that point, really appreciate times on our side. So I'll leave it there. I think Sam's covered the main bit.
Wonderful. Thank you very much, Councillor Patient. Councillor Hutchinson.
In terms of responses to the climate action plan questionnaire, are we promoting it through schools and Calderdale College, for example, to try and get more of the young people's voices expressed in the response? I also wondered, in terms of transport, whether, as the NHS is such a large employer within Calderdale, whether some of the lessons that have been taken from the Forth Valley NHS have been considered in Calderdale, where there has been particularly promotion of active transport, both for people getting to work on hospital sites, but also for community services to facilitate the use of e-bikes and the like, including transport hubs within the hospital sites and community sites. I'd also like to flag up that in terms of encouraging people to switch to using public transport, the withdrawal of government subsidies to routes that are not commercially viable was due to occur at the beginning of this month. It's been tapered, so it's going to continue till at least December. But from March onwards, will probably go all together. And if that happens, many of the bus routes in Calderdale will not be commercially viable unless a lot more people use them. And we really need to be flagging up to people that if they don't use their local bus services, they may well use it. And there are some communities that are at risk of losing all bus services locally. So we really need to be getting our act together and getting people onto the buses.
Thank you, Councillor Hutchinson. Just visited Tallinn in Estonia, and it's €1 per day for residents for all public transport, €30 a month, which is not quite as good as it being free of charge, but it would be a step in the right direction to do something like that in Calderdale. Most of the users,
not just cost, it's reliability.
Of course it is.
Reliability
Absolutely
is the major issue.
Yeah, absolutely right. Anna from CHFT. Anna.
Thank you, and thank you, Sam, for your presentation, and nice to meet you. I know we're going to be catching up later today, so that's quite timely. I just wanted to, I think it resonates with some of the points that Councillor Hutchinson's raised. I think there's a really important role for health and social care providers to directly contribute to these three themes. And we've been doing some work about how, by providers working together, can we really amplify our work on climate change action. We know that health and social care is one of the a significant contributor to some of the carbon load and emissions, but equally we have large areas, potentially of large areas of land that, you know, taking forward biodiversity and greening, our buildings, how we use our buildings, our emissions, our embodied carbon within those, but also how we can help in supporting the shared voice. And hopefully it does resonate with the previous item on the agenda, where there was discussion around us being an exemplar as well to help to support and encourage and share learning with other organisations. So I think it's really positive. In terms of opportunity for other meetings, Councillor Patient, I know that this is a topic that's going to be raised at the Calderdale Cares Partnership Board informal workshop next week, which is all partners in that group, and that Sam is coming along to that meeting to help. So I think that's a really good audience. Thank you.
Thank you, Anna. Julie.
Thanks very much. I just wanted to pick up on a couple of things that Councillor Hutchinson said, please, just particularly in relation to the education sector. I just want to share with you that the government has published a sustainability and climate change strategy for the education sector. This happened in April this year. So what they want to do, the ambition is to make the UK education sector a world leader in climate change by 2030. So there's lots of things they're doing around introducing new GCSEs, etc., and helping young people explore about the environment and sustainability. But they also want to have a sustainability lead, they're calling it. You know, schools have leads for children looked after, child protection, but there'll be a sustainability lead in every nursery, every school, every college, and every university. So they're going to be supporting the teaching of climate change at all levels. And by 2023, further education leaders have got to build sustainability into their teaching. So you can see how this is really trying to embed that approach right across the education sector. They're also trying to roll out ultra low carbon education buildings, and Sam Saxby and her team have been talking to my team in education about that. And just moving schools and colleges on what they're calling the Gen Zero platform. So there's actually quite a lot happening there in terms of the education sector being led by the DFE. But more locally, I think most people know at Health and Wellbeing Board that one of the pictures that Sam has shown you is a picture of one of our young people who's quite a leading light on our youth council. Who attended COP26, who's called Will Solomon, who spoke very eloquently to COP26 about this. So we've got a real kind of leading light there within the borough. But we do an awful lot of work locally as well. I think you remember, Councillor Hutchinson, this is probably pre-COVID, but one of the pupils at one of our primary schools felt really, really strongly about parents dropping their children off outside the school. It was actually Savile Park Primary, and idling the cars and the engines and the carbon emissions right next door to their playground, who brought a petition and kind of asked for support at full council. So, you know, our young people care about this, you know, really passionate about this. And there's lots happening around walking buses and kind of closing roads and you know, making people walk to schools. You know, so Sam's team are doing an awful lot, you know, an awful lot of work on the ground as well behind the scenes. But I just wanted to share that with you, a bit of the local approach and a bit of the DFE approach. Thanks very much.
Thank you, Julie. Okay, maybe finally, Councillor Evans, and then back to the presenters if you want to share any further final comments.
Thank you, Chair. Just be very quick. Thanks to Sam for the work she's doing and a good presentation. I think as a councillor, we promote this on a regular basis via e-newsletter to residents. We're making it a standing item on ward forums. We're contacting all schools in the ward to encourage them to get involved along the lines that has just been outlined. And I would urge all other councillors to do a similar thing. They probably are doing, and if they have any hints to us in our ward as to what we could and should be doing, very happy to listen and take it on board. Thank you.
Thank you, Councillor Evans. Maybe one final thought around the 21 general practice buildings estate in Calderdale as well. I'm sure that they would welcome any sort of advice, guidance as to how we can improve the estate in primary care. It was part of a quality scheme last year to try to improve lighting and other efficiencies. So there are some things happening. There is a training event that happens on a regular basis where most practices are involved, and I think coming to that and speaking about the climate emergency and the action plan might be a good idea, and I think it would be welcomed by primary care colleagues. So I'll liaise with Sam perhaps and Councillor Patient and the local medical committee who organise those training events to see if we can get a half-an-hour slot just to talk about the climate emergency and the climate action plan, if that's okay with yourselves. And I'm sure that other colleagues around the table from other organisations can be thinking of other gatherings taking place in the near future where this can be on the agenda. Is there any final comments that you had, Sam or Councillor Patient, from what you've heard?
No, just thank you so much for your time, and obviously the consultation is open for around another month, so anything you can think of, please let us know, or you know, just go off and please promote it for us. That'd be brilliant. Thank you.
Excellent. Thank you very much indeed, Sam. Okay, so if everyone's happy, we'll move on to item 9 of the agenda, system pressures. This is an oral report, and I think Neil Smurthwaite, Chief Operating Officer of Calderdale Cares Partnership, is ready. Hopefully ready. There we
Yeah,
are.
sorry, it's just slow unmuting. Apologies, Chair. So yeah, this is sort of more an all. I'm sort of leading on this, but it is for partners to also contribute to as well. So this is a usual standing item where we sort of have a general discussion about what's going on in the health and social care system at this moment in time. I suppose there's two things to sort of highlight to the board today, which are sort of closely linked as we approach winter. So I think we regularly report as across the sectors of how busy demand is and the increasing sort of demand on either GPs or hospital or mental health services, which those continue. However, hot off the press yesterday, NHS England, from a health perspective, have issued some significant guidance to us as partners with regards to planning for winter. So we've all done our local sort of winter plans, and we work together through, I suppose, an escalation process with regards to the sort of demand on health and social care systems through our gold and silver reporting structures. However, there's a requirement for us to set up some system coordination centres which look at the activity on a live basis around hospital activity, emergency stuff. So there's a huge amount coming down from above about how our systems, particularly in places and our acute footprints and our primary care footprints, are operating over the winter months. So there's a lot of concern. We're currently at high bed occupancies in all of our acute trusts across West Yorkshire. We're seeing increased levels of admissions or people in hospital beds with COVID, which is my second point. I'll come on to it again there. So there's increased evidence on a daily basis for there to be significant sort of scrutiny and support around how things are flowing and how we're managing the system. One of the key actions of which I was going to raise yesterday is to ensuring that we're maximising our winter flu and our COVID vaccination processes. So I am aware a lot of our general practice and pharmacies are doing big numbers on winter flu, and our COVID continues to be rolled out, and we'll be meeting deadlines about our most vulnerable home-based and care home-based patients over the next few months, which we recognise they're at significant risk over the winter sort of months. So it is just a plea for people that have had their invites to sort of get booked in, get your COVID jabs and get your winter flu jabs. I know a lot of employers will be arranging these for staff as well, but it's a key sort of strand that central figures are asking us to maximise as much as possible as we head into a very expected tricky period for health and social care services. So they're the two sort of key things I wanted to sort of highlight about the pressures and the sort of the work that's going on. This will clearly make a big focus for all our providers of health and social care over the next few months, on top of everything that's progressing quite well around elective recovery and things like that. But yeah, there's a significant ask of local resource to monitor positions as we get into winter going forward. I'm happy for others to help contribute on the pressures that they're feeling.
Thank you very much, Neil. Does anybody else want to contribute in terms of system pressure update? Please, Anna.
I just wanted to comment and say I think Neil's provided a really good summary there of some of the pressures around. We've got maximum number of beds open, increasing number of patients with COVID, working really closely with partners and working really paying great attention on our elective recovery and trying to keep both the urgent demand being met and also continuing to make progress on reducing the backlogs of care. So it is quite a pressurised time and working closely with partners. So it's just to say we absolutely recognise and grateful for the support across all the partners working on this through this difficult time.
Thank you, Anna. Anything on the flow out of hospital and into care sectors or beds at home, reablement, or the various community services? Anybody to give an update on delayed transfers, people who are medically fit for discharge, blocking beds, etc.? Anna and Mike.
Yeah, just to say, Chair, that Kath Gormally has lost her connection.
Yes, I saw that.
And I'll ask Kath after the meeting if she's got anything she wants to circulate about social care for adults, and we'll put something out if she's got an update.
Yeah, I think probably Anna and Neil could also help, but that's also good, Michael. Thank you, Anna.
So I was going to say we certainly do have a number of patients where we know we have in the region of around 90 patients waiting for discharge, and we're working really closely with partners. I think Neil, it's probably good to come in just to talk about some of that work.
Thank you, Anna.
Yeah, thanks, Anna. So yeah, the right to reside stuff is a sort of a daily conversations between providers. I think one of the key sort of sticking points that we're working through is around COVID, and as Anna said, there is a rising number of people in beds, and we do have issues with care homes not taking positive people, which sort of adds to the number. But there are difficulties in the market, and everything is sort of being done as much as possible. I think between health and care providers, clearly there are issues in the Upper Valley with home care and issues there, which I think are well known to this system, but lots being done to try and unblock that and think innovatively about how those sort of services can be provided. I think one of the key things that's been sort of discussed through the urgent care board, particularly around the detox position and bed flow, is to try and get upstream and be more proactive with our community services, with our actions with people that are in the community and that are known and are potentially frail. And that is one of the asks that's coming down centrally, to look at those that are high risk and ensure that there is care and services wrapped around them to avoid admission where possible, so that they don't end up in hospital, and we can care for them in their place of residence.
Excellent. Okay, thank you very much, Neil. Is there any other comments from members around system pressures? If not, we will move on. Okay. Sorry, Councillor Hutchinson. Sorry, you're on mute, Councillor Hutchinson.
Sorry. Can I ask, thank you, Chair. Can I ask Neil how far we've got with immunisation, the boosters for care home residents and staff? How far into the programme have we got? And also for vaccination, for booster vaccinations to staff working in the trust, certainly in the patient-facing sort of staff.
So on health and social care staff, Colin, it's not something that's significantly monitored at this moment in time, but with regards to residents in care homes, we're over 70%, and we're on track to have visited all care homes by the 24th of October. So there are some planned this week by our GPs. With regards to the hospital, Anna may be able to help with that, but the hospital hub has been up and running for a few weeks with regards to ensuring its staff are jabbed, but those numbers aren't being collated this time.
Okay, and can I just ask, we have previously had quarantine facilities for patients who've tested positive if those can't be provided within care homes. Are we looking at that for this winter?
So quarantine facilities in the hospital setting, you mean?
No, I was thinking hotels we've used before, so that you can step down people who are otherwise fit for discharge but have recently tested positive for COVID before they return to their care homes.
Okay, rather than testing positive and going back to a care home and causing a challenge.
Yeah, exactly.
Neil, Anna, anything on this?
All areas are being explored with regards to beds. Whether that is something we're looking at this moment in time, Colin, I can't confirm. Some of this will come down to funding availability. So that was funded out of national COVID pots at the time as part of the pandemic. Whether that money is available now has to be seen. There was an announcement about £500 million available nationally to create extra bed capacities, which some has gone to acute hospitals to enable them to maximise beds. However, beds is a huge concern. There are risks around that, which I'm sure Penny will sort of elaborate on, but there aren't plans at this moment in time. And I think some of those difficulties, Colin, is finding staff and capacity to be able to manage those as well. So we're having difficulty, particularly in Calderdale, with our care and nursing home market with regards to resources and our ability to maximise in those. We have a shortage, but clearly lots of these things will be considered in the coming weeks.
Thank you, Neil. Anna and Penny, finally on this then.
Mine was just a comment about the colleague uptake of the vaccine in the hospital. We are running clinic sessions on both sites, alternating sites, and offering drop-in and booked appointment time. We're seeing those slots being really effectively used. We're offering both flu and COVID vaccination at the same time or separately if colleagues prefer. So at this time, we're seeing numbers are continuing to increase. We've made good progress since those clinics started, and we're seeing good uptake at this time. So I think the number roughly we're in excess of a third of our colleagues, heading more towards sort of like 40% of colleagues have taken that opportunity, and we are seeing and expecting that to continue to increase.
Thank you, Anna. Penny, finally.
Yeah, just was just wanted to provide a little bit more assurance to Councillor Hutchinson in relation to the beds outside of hospital for people that are COVID positive. So I think you'll recall in the previous 2, 3, 4 waves, we've had access to what we call designated beds for COVID positive patients who required ongoing nursing care before going back to their care home of origin. And that being an initiative across Calderdale, Kirklees and Wakefield, with beds available in the Kirklees footprint for us to be able to access from Calderdale and Huddersfield Trust. Colleagues are exploring that again to see whether that is actually required at this point in time and how easy that will be to be able to step that up. Utilisation, to be fair, was being relatively low throughout the previous waves of the pandemic. So numbers are quite small, but we do recognise that even in small numbers, being able to free up beds in the hospital is important. So I'd say assurance that work's going on to look at those opportunities in relation to particularly the designated beds for ongoing nursing care.
Very good. Thank you for that clarity, Penny. It's very helpful. Okay, I think that's item 9 completed then. So item 10 is just reports for information. Just to note that the pharmaceutical needs assessment is there and also the forward plan. Mike?
Thank you, Chair. Just to say about the pharmaceutical needs assessment is that, as sometimes happens, the deadline for the report to be submitted didn't fit with our meetings. So Councillor James Scullion, as Deputy Leader of the Council and standing in for Councillor Tim Swift, who, as members will know, has had an operation and is recovering well. Councillor James Scullion approved the PNA on behalf of the Health and Wellbeing Board. So we're asking, we've included the paper, the whole PNA on the agenda papers, but we're asking you to endorse the approval that Councillor Scullion made between meetings of the document.
Excellent. Thank you for that clarity, Mike. Is everybody comfortable with that? Yeah, and then very happy to endorse. Very good. Okay. And then the forward plan. There are items on it. That's just for information again. I think, is it the 5th of January, the next meeting, Mike? Yeah.
That's correct, but there is an informal meeting of the board on November the 17th that will look at making sure that the work of the board and the Calderdale Cares Partnership Board is aligned. That's something we've talked about in the past, and also to update and to discuss issues about people with learning disabilities that picks up on work that the board did last year. And it's envisaged that meeting in November will be in the town hall and a face-to-face meeting.
Very good. Sharon.
Thank you, Chair. Just to let colleagues know as well that the forward plan will also have the item on the VCS sustainability report that's been moved from this meeting. Thank you.
Thank you. We didn't see you, Sharon, but we recognise that voice very well. Okay, I think that concludes business for today. We've got 7 minutes back to go and have a comfort break before any future meetings, and hope you all have a wonderful rest of the day.
Thanks very much, Dr. Clearsby. Bye, everybody.
Bye.
Thank you. Bye.
Bye.
Thank you. Bye.
Thank you.
Thanks, everyone. Bye.
Cheers, Mike.
Thank you, Dan. That all went
right, I'll just end the stream.